afternoon, everybody. I hope you're doing well and enjoying your Tuesday morning or Tuesday afternoon. It's beautiful outside. So I'm not going to be taking too much of your time. I'm going to be sitting here and discussing a little bit about surge and preparing for this year's cold and flu season. We're going to put a lot of emphasis on preparation for this year's cold and flu season, what to expect. We're going to go through a little bit of trends and then we'll finish it off with some surge framework information and discussions as well. So I guess as I usually say, without further ado, let's begin. So today's presentation, my objective today is just to explore current trends. So this is what you've been sent out by our lovely person here, Mushta, and thank you for this as well, regarding some of the topics of today. So we're going to talk about or explore current trends and activities in the community. I'm just going to basically talk about what's been happening in terms of infectious diseases, which are the ones that have been highlighted. Mind you, I did miss measles because I've been discussing that over and over and over again over the past couple of months, so I really didn't get into that at all. We're going to learn strategies to prepare for seasonal and unexpected challenges. It's just going to be a basic mishmash of what are we expecting, what you should be preparing for, and what you should be looking for. We're going to anticipate and manage surges. Just again, a brief synopsis on what we need to do. Respond effectively to cold and flu season or respiratory outbreaks. So a major part of today's discussion is going to be on respiratory outbreaks, surveillance, monitoring, because during this period of time, we tend to run into surge because of the yearly respiratory outbreak season, or as I like to call it, cold and flu season. So there's going to be a little bit of a basic discussion on that as well, or talk on that. From there, we're going to talk about understanding and address emerging community needs as they arise. And then we're going to talk again very briefly, which is all going to be a mishmash of pushed into the presentation, the adapt planning to ensure safe, efficient, and client-centered care as well. So with that being said, I'd like to talk a little bit about the respiratory diseases trends that we've been experiencing this year. And during the year, we typically go from January to March or April, Mayish, seeing a lot of high cases of respiratory illness or respiratory diseases, and it starts to taper up in and around May of the year. Things get easier. There's low positivity rates as well, but as we get into September, October, November, we start to see a severe incline in terms of respiratory diseases, in terms of trends. And I just have a basic comparison to show you that things do taper off in May and are still fairly low in September of 2025 in terms of COVID, influenza, and RSV cases. However, at this time, if you do have the opportunity to look at the Ontario Public Health tool, respiratory diseases tool that predicts some of the trends, and even the wastewater tool, there has been a substantial increase in the amount of COVID in the wastewater system. So we know that sometime in October, there's going to be a exponential increase of cases, which we tend to see every year. And that's not just for COVID, that's for influenza and RSV. However, at this time, being at roughly around the beginning to we're mid-September, the case positivity rates are fairly low for all three, COVID, influenza, and RSV. But again, as I said, you're going to see a tick up in coming weeks. So we're going to speak briefly on how we're going to monitor and do surveillance to ensure that we pick these things up with our clients and within our homes, if it's just long-term care homes or chronic care setting people here, what to look for in terms of new cases and to keep an eye out for. So again, we're going to touch upon these factors a little bit later on in today's presentation. West Nile and Lyme disease, as we're still on the topic of trends right now within the environment or within the community, these are the two big things that we've been seeing. On top of measles, as I said already, I didn't want to get into measles too much because we're still in that IMS model in regards to measles, meaning there's a lot of new cases out there, It's in a specific group of a group within a specific region, but it is spreading, and it's somewhat going to be under control. And sometime, hopefully, in the next coming months, things will be should subside as we roll into respiratory season. But some of the other infectious diseases that we do see out there in the community that a lot of our public health agencies are dealing with as well tend to be West Nile virus and Lyme disease. And just a brief synopsis on what West Nile virus is. West Nile virus is spread through the bite of an infected mosquito. The mosquitoes typically get infected by biting an infected bird, and this has become an issue over the last 25 years. I remember our first case in Canada was in Niagara Falls in 2000 when I had first started working public health in Niagara, and it's now become I wouldn't say epidemic, but somewhat of an endemic issue where we deal with it every single year. Most people who get infected with West Nile virus don't get symptoms at all, but there's a small percentage of people who do, which is roughly 20% who will have something such as a flu-like syndrome or flu-like symptoms. And out of that, maybe 1 in 150 will get serious symptoms. And when we talk about serious symptoms, we're talking about meningitis, infection of the meninges, and encephalitis, or in some cases, even paralysis. People who tend to be infected or tend to be affected by this virus tend to be those who are immunocompromised. So those who are older and have immunocompromising issues as well, cancer on chemo, HIV, other forms of immune suppressants, they're the ones that tend to be affected by West Nile virus. And our preventative measures, again, is typically mosquito repellent, wearing long sleeves and pants when you know you're going to be exposed to a lot of mosquitoes, and getting rid of standing water, which can become breeding sites around your home. And I know a lot of this is things that we tend to do at the beginning of the summer to help preventative measures to prevent ourselves from getting infected. But again, as I stated, in and around the end of the summer and around this time period, September, we tend to see increased cases because with this virus, it incubates for a very long time. And in a lot of cases, what tends to happen too is also misdiagnosed. So it's one of those harder viruses that are very difficult to diagnose. So again, we're on the community. We do deal a lot with our clients. If you do see a client who does seem lethargic or sick, again, refer them to their GP. It could be West Nile virus. Who knows? Again, as we continue that trend of what's happening in the community as well, another one is Lyme disease. We do see an uptick in the amount of Lyme disease cases in and around this period of time, and it tends to happen around now as well. Lyme disease is usually spread through the bite of infected black-legged tick. It must be attached to your skin for more than an hour or at least 24 hours to transmit the bacteria that causes Lyme disease. We call it Borrelia burgdorferi, is the name. Most cases in Ontario occur in between the months of June to August. We're now in September, so you will see a lot of them dwindling over into the September months. And left untreated, there can be serious complications, including inflammation of the heart, meningitis, or arthritis and nerve damage as well. Some of these symptoms that tend to be indicative to Lyme disease tend to be fevers, headaches, muscle aches, along with enlarged rashes. And as Loeb, who is one of the Infectious Diseases Institute professionals or experts, explains, you may feel like you just caught the flu when you have Lyme disease. So if you haven't noticed the uh, the continuation of symptoms or the likeliness of symptoms between West Nile and Lyme disease, they tend to be the same in terms of flu-like symptoms. And the best way to prevent getting Lyme disease is to avoid tick bites by using insect repellents, wearing proper clothing, and removing ticks as soon as possible after bites. So typically in the summertime, what we like to ask you that you do is wear clothing that where you can see that isn't dark colored actually, where you can see whether or not the ticks are on you, getting them off, using repellents, and just being very proactive when doing these hikes in wooded areas as well. So again, as I mentioned, the things that we're looking at in terms of trending right now in our community is measles, which is the big one. COVID-19, which is on the rise again, being that moving into respiratory season again. And on top of that, part of it is there are new variants, which I will get into a little bit later after this slide as well. RSV and influenza, which we typically every single day during the period of the year, we're always following these different variants as they spread from country to country. So I like to say that the reason why we know what we're dealing with when it comes to influenza season, which is coming very shortly, is because World Health Organization and all the other powers that be monitor and follow the virus as it circulates its way in and around the world from Australia and makes its way into Canada or North America as we start to get cold and we start moving indoors more frequently. So those are some of the things that we are looking at right now in terms of community trends. And again, just a quick synopsis, just a quick look at this slide. Just basically tells you the year to date, the amount of cases that we have pertaining to West Nile virus, which is 61, Lyme disease, 1,927, and anaplasmosis, which is another virus that we deal with. This is a lot of times this tends to be on dogs, but it does have the same form of symptomology as Lyme disease and as West Nile virus with flu-like symptoms. And then we got babesiosis and Powassan virus disease, which is only three. Again, a lot of these things tend to look the same, but are usually spread by ticks or by the bite of a mosquito. And these are the things that we are seeing right now in the community that we are dealing with. And as we get to the dreaded COVID-19. So we've been dealing with COVID-19 for the past 5 years, and it's something, as I've stated in many times in a lot of our meetings, is we're going to be dealing with this for the rest of our lives. It's going to end up like how how influenza is. Every year you get an influenza vaccine or respiratory syncytial virus, RSV, with their new vaccine, or how we deal with other respiratory diseases. This is something that's, I like to use this word ubiquitous, but it's going to be out there regardless. And it's going to be one of those things that we're dealing with 24/7, 365 days out of the year. With COVID-19, again, just touching upon some of the trends in the community, it's still a serious threat for a lot of people with compromised immune systems and pre-existing conditions that can cause complications. So people that are immunocompromised is the biggest issue. The elderly, 65 years of age or older, they're the ones that tend to be hit fairly hard by COVID-19. One of the things with COVID-19, the reason why I'm talking about it now, our kids are going back to school. No one's wearing masks in school. And I mean, I hate to say this, I'm a father of a 16-year-old and 13 and 12-year-old. And you know what? Hygiene, mind you, they do shower all the time, but washing hands or sanitizing hands tend to be a bit lower than those than adults sometimes. And they're going to be bringing home things as well. So, a lot of times we ask people to be very vigilant with their family, ensuring that they're washing their hands frequently. They're cautious if they're sick not to be going to work, and other things such as that. And to also monitor your clients that you deal with as you revert into outbreak season. Again, as I stated, there's going to be an uptick in amount of new cases, new severe cases of respiratory disease, influenza, COVID, and RSV. So keep an eye out. And a lot of that has to do as well with the introduction of new variants. I mean, we've been dealing with this for 5 years. Every year we're getting two or three new variants, and it's expected because these viruses are going to go through genetic shifts or genetic drifts. They're gonna mutate, and it's something that we are expecting. Thing is, when they do mutate, I have to say that they become very professional, very efficient at infecting people. So we do have these two new variants called the Stratus and X-ray Foxtrot Juliet, which is XFG. Stratus is a recombinant of the two Omicron lineages. So if everyone remembers Omicron back a few years, how things just blew up one Christmas, this new variant is an offshoot of that. And it has the same capabilities of dodging antibodies and infecting people. So again, knowing that we do deal with a lot of high risk clients, I should say, not cases, those who are 65 years of age and older, who are immunocompromised, who have key medical issues as well. Just keep an eye out. Again, because of the mutation of these variants, again, as I said, they're very efficient in affecting those who are high risk clients. So our clients that we deal with. Another variant is, as I mentioned, is X-ray Foxtrot Golf is also a recombinant of or a hybrid of the two existing Omicron strains. So again, Omicron, that's the dirty word. A lot of these variants come off of that offshoot or recombinants of those as well. So again, with this new variant, it's very efficient in affecting those. So again, just keep an eye out for clients that may present with any flu-like symptoms and have them seek medical attention as soon as possible as well. The sooner the better. Now, with that being said, a lot of I know a lot of everyone expects me to speak on surge, which we will deal with just now, but a lot which what does cause surge, I should say, is again the time period of the outbreak or respiratory season, cold and flu season. The reason why we do get into surge is based on the amount of new cases of infection, respiratory infection. And a lot of times it doesn't just affect our clients or our patients, it affects us as well, as staff members, management, employees, doesn't matter. It affects everybody in the community. So a lot of this has to do with being prepared for outbreak season. To help, not alleviate, but to help control surge, one of the first things we have to do as a group or as a sector is to provide proper surveillance and reporting. So we need to understand what's happening in the community, which we do now. RSV, influenza, and COVID levels are low. The percent positivity is low. However, as of yesterday, in Canada, and I'm going off of a paper that I was reading, there were about 19,000 tests and a few thousand tested positive over the last couple of weeks, which gave us an 8.5% point positivity for influenza, sorry, for COVID, showing that the numbers are increasing. And again, as I stated, the wastewater tool that is used by Ontario Health to monitor COVID levels in our community is showing a substantial increase as well. So we know that we're going to expect these cases to start showing up on our front doors when we go into our homes, when we go to work, and amongst our family and the community. So the earliest thing that we can do is to provide proper surveillance and proper reporting. So what does that include? That includes early recognition and reporting of unusual clusters of, I don't want to say gastrointestinal, as mind you, that is one of the symptoms, or respiratory illnesses and as important in an organization. So what we ask that you do is start doing proper passive or active monitoring or surveillance of staff or clients as well as they come in. Uh, there's nothing wrong with you asking over the phone prior to going into a home, prior to them coming to an ADP program, whether or not they're feeling well or not, whether or not they have any type of respiratory illness. And there's nothing wrong with you excluding them if they do present with these symptoms as well. That's usually the first barrier of protection in our organizations and for ourselves as well when handling or dealing with ill clients. So first step is community areas are strongly encouraged to foster or enhance existing partnerships to include infection prevention and control measures and education on early recognition and reporting of the illness so that a timely and coordinated response can occur. So what that means pretty much is we all have an infection prevention and control program that's been implemented in all of our organizations. We've all gone through COVID, so everyone is extremely professional or experts, I should say, in proper monitoring and surveillance of clients. As I mentioned previously, ensuring that clients understand that if they're sick, they're not to come in, educating staff on the importance of monitoring those clients, and even simple things such as washing your hands, simple hand hygiene prior to coming into work are some of the things that we want us to start reinforcing to our staff members as well. So again, as I said, in proper infection prevention and control measures and education on early recognition and reporting of illnesses. So they have to understand that if they do see anything in any one of their clients or patients, they are to report it to head office or report to the powers that be. And if that person is sick and if they are sick themselves, they are to exclude themselves or have those clients excluded as well. It's also strongly recommended that each community area keep current a directory of all staff and clients. So as we kind of get into the surge talk or surge realm of things, it's good that all organizations have an up-to-date directory. And the reason why we ask for that is in some cases, when we run into outbreak season, what tends to happen is, again, as I mentioned, it's not just the clients, it's not just the patients, it's also staff members. And to be able to meet the needs of our clientele, we have to ensure that we have staff members that are readily available for work as well. So by keeping an up-to-date staff directory and client directory as well, be able to communicate quickly, effectively, and efficiently to clients or to staff if things were to get out of hand during surge period as well. A lot of organizations have other organizations that they can depend on, outside stakeholders that they can call whenever they run into situations if they need more staff. If they're, and I find with our sector, we're really good in that if we're missing things or there's a lack of masks, for example, we have great relationships with other organizations where we can borrow things. So simply having their numbers, updated staff and client numbers makes things move much smoother and efficiently when we do run into these surge periods as well. And this information will facilitate early planning communication with public health. So if you do run into a situation, if you're a congregate care where you are an outbreak, quick communication and with public health makes things move much easier and quickly as well. Helps them to come out to start the outbreak investigation and helps them to help out with in terms of implementing certain policies and procedures to help minimize the spread of an infectious disease or respiratory disease. Again, if you're living or working in ADP or working in a or living in a congregate care setting as well. So these are some of the things that we have to take in consideration. Now, simple outbreak tips and for respiratory season, and this is all in the auspice of surge, because as we run into outbreak season, I'm going to say it again. You might hear me say it 3 or 4 more times. Outbreaks in the community and within our organizations tend to be the key reason for a lot of these surge issues. So one of the things that we want to do to help facilitate and help manage surge is to promote vaccination. So encourage annual influenza vaccines and COVID and RSV, and stay up to date with COVID and other respiratory vaccines as recommended by Ontario Ministry of Health. Vaccination is one of the most effective ways to reduce illness and transmission. So every year, we have something called UIIP, Universal Influenza Immunization Program, and other immunization programs for RSV and COVID. It's great that we ensure that we push this to our staff and to our clients as well, those who are immunocompromised, those who are in the high risk categories. I didn't want to get into it too much today because that's going to be a long presentation, but we do have some updates in regards to the 2025-2026 immunization time, our period. And what I will be doing in the coming weeks is sending out invitation for us all to sit down and review that together, the changes that may be in the immunization program for this year, what's in the vaccine and what to expect, and who's going to get vaccinated first. All that lovely stuff is going to be stated in another presentation. But again, as the NACI normally states with National Institute, National Advisory Committee for Immunization, you should get immunized every single year for influenza, COVID, and RSV, staff and clients as well. Highly recommended. Another thing that we have to understand, and I guess again, under the umbrella of surge and preparing for surge, is understanding that if you are sick, stay home. So encourage employees, students, and community members to stay home if unwell to prevent spreading respiratory viruses. This is especially important in high-risk settings like long-term care homes, childcare, and healthcare again. So if you are sick, runny nose, not feeling good, even gastrointestinal symptoms, stomach ache, vomiting, and diarrhea, stay home, call ahead, let your staff, let your powers or your management know that you're not coming in and exclude yourself from work. If you know of any clients that are coming in who are complaining of these symptoms, exclude them from their programs as well. If you're ADP, if you're a congregate care setting and someone's complaining, a staff member, keep them home Patient within the home, then you have to really keep an eye on them and do some surveillance or monitoring to figure out what it is that they have and be able to get in contact with public health if things do get out of hand. So understanding that, hey, we have a cluster of ill patients or clients in a home, I think something's going on. So again, stay at home when sick. Another simple one, very simple, practice good hand hygiene. Wash hands frequently with soap and warm water for at least 20 seconds or use alcohol-based ABHRs 60 or 70% and above, 60 to 90% if soap and water aren't available. Hand hygiene reduces the spread of germs picked up from surfaces. So, as I always say, number one way to prevent the spread of infectious diseases during respiratory symptoms or during respiratory season is simple, good hand hygiene, practicing good hand hygiene. So this is a time when it is good for you to start reminding staff again, guys, we're going into that season again. It's that time of year once more. Please be very vigilant in terms of washing hands. Be very vigilant in terms of when to wash your hands. For instance, when taking off your PPEs or before putting them on when dealing with any sick client or resident as well. And as we continue the simple outbreak tips for a respiratory season under surge, practice respiratory etiquette. Cover coughs and sneeze with a tissue or elbow, dispose of tissues properly, and wash hands afterwards. This limits droplet spread as well. Very simple, straight to the point, and self-explanatory. Improve ventilation indoors. Increase airflow by opening windows where possible, maintaining HVAC systems, and using portable HEPA filters in crowded or poorly ventilated spaces. Good ventilation dilutes airborne viruses. And this is something that a lot of our ADP programs do, and it helps to alleviate the spread of infectious diseases. And my favorite one, which also severely minimizes the spread of respiratory diseases, is regular cleaning and disinfecting. So clean frequently high touch areas. And when we talk about high touch areas, talk about doorknobs, phones. I call it converters. My kids make fun of me and tell me I'm getting old because I call it converter. But TV remotes, railings, light switches. Often, especially in the workplace, schools, and healthcare settings, viruses can survive on these surfaces for many hours. So regular cleaning and disinfecting of your facility should be something that you should be looking at doing in and around this period. Again, sitting down with staff and explaining that, hey, you know what? We're going into respiratory outbreak season. We have to be very, and I use this word already, vigilant in preventing the spread. So please, if we have to increase one more duty or cycle of cleaning, just to ensure that we're protecting ourselves and protecting the people that we take care of as well. And again, these simple tips will help to alleviate some of the issues that we have during surge. Another one is use mask in high risk situations. So we do point of care risk assessments, PCRAs, prior to going into a room where someone is sick. Using a proper medical mask is very important, and ensuring that your staff have all been mask fit tested as well prior to getting into outbreak season is a very good practice as well. I know during the summertime, I've had the opportunity to sit down with many staff members and ensuring that everyone's been mask fit tested. Please ensure that that's done as well, because when we run into outbreak season and you may have an outbreak in your facility, in a lot of cases, wearing a proper N95 goes a long way as well. So consider wearing a well-fitted mask in crowded indoor healthcare environments, especially during outbreaks or if you are in communocompromised. Ontario Public Health agencies often recommend masks in long-term cares or outbreak settings. ADPs, it doesn't matter what it is. What I would do too as well, in and around this period to help alleviate the strains of surge, is ensure that you have enough equipment as well. Go in, do an audit of how many masks you have, how many hand sanitizers you have, how many PPEs you have. Just ensure that you have a right amount of stockpile that is situated for yourself in case we run into a period where things do get really bad as well. So now's a good time to start providing audits within your facility. Training staff and providing audits are two big ones that will go a long way in helping to alleviate the constraints with surge as well. Protect vulnerable populations. Extra precautions should be taken for seniors, young children, pregnant people, immunocompromised people as well, more at risk of severe illness. Again, just protecting the vulnerable. I like to say the more training you have, it goes a long way, letting people know that, hey, we're running into that season, a time of year again. Please look out, be ready. Please provide as much information as you can. If you are ill, please assess yourself prior to coming in. Simple things such as that go a long way too as well. Following public health guidance. So in around this period, we're going to get a lot of information from public health. Public health likes to strongly recommend masks, the wearing of masks, be it N95 or medical masks, in around this time period. With it, excuse me, within certain institutions as well, and within certain sectors. This is around the time when we start getting more information pertaining to immunization programs, what are in the vaccine, when you can get vaccinated. And this is a time when a lot of information pertaining to audits within your facility. Here are some audit tools that you can use. Here's the outbreak management tool to be used. And having that will go a long way as well in addressing any surge problems too. Again, a lot of times we can be as prepared as we want to be. There are so many other factors that are involved in the wheel. So it doesn't just mean because we're prepared surgeons is going to occur. It will occur. But at the end of the day, if we have all these, I hate to say these boxes checked, that helps things out for ourselves when coming time as we get deeper into the outbreak season as well. And then simple things such as encouraging healthy habits, promote adequate sleep, balanced nutrition, hydration. I know it sounds really simple. I see it all the time. They told me this many years ago. I did everything and I still had a heart attack. But at the same time, you know what? It does go a long way. It does help to alleviate some of the strains when you're well rested, you've had balanced nutrition, you're hydrated, and it helps to reduce the severity of infection. So I mean, you could do everything perfect and still get infected with COVID. I've had COVID 2 or 3 times in the past already, and I've done everything that I needed to do to prevent myself from getting it. It just happens. But if you're a well-maintained and a healthy person, you're taking care of yourself, the duration and the severity of the illness will be will be lower and less as well. So those things should also be taken into consideration and be dealt with when dealing with this time of the year. Surge during outbreak season. So, again, as I spoke on surge just now, we've been doing a lot of, I've gone around quite a few times to discuss it. And it's one of those things that we need to be prepared for. And that's the biggest reason why we're discussing outbreak management, because that's going to be one of the single most it's going to be the biggest cause for surge is because of outbreak season. So what is it truly, and what am I talking about when I'm talking about surge? We do have a definition. I've talked to many other organizations on many committees and many boards, and we've put together a definition of what it is. And it's just a structured approach to handle sudden increase in service demand and ensures continuity of care with trained staff, clear communication, and contingency plans. So as I mentioned before, in the outbreak slides, trained staff, clear communication, and contingency plans just in case. So we have stockpiles of PPEs. We have updated directories for communication to public health and to staff and to residents or to patients. And we have trained staff. That goes a long way in alleviating. And why it matters is it supports the Ontario's community services agencies in managing surge emergencies effective. So when you do these things, it helps to manage, as I've mentioned already, it's gonna happen. No matter what I say or do, I've been doing this for 26 years now. Every single year and around this time of the year, we're always gonna run into outbreak season, cold and flu season. Hospitals are gonna be inundated with a lot of sick patients. Our clients and our staff are gonna be sick. The most we can do is by training our staff to recognize this and understand it, and to being prepared will help alleviate a lot of that stress that a lot of our organizations feel around this time period of the year as well. So by having these things in place, or these components in place, it will make things much easier for you going for further or going forward during outbreak season as well. And whenever we talk about surge, there's always factors that contribute to this, and we're all within these factors. So aging population, ADPs, a lot of the people that we deal with are 65 years of age and older. They're aging. Public health crisis. COVID-19 was a public health crisis. Every year we run into outbreak season. That's a public health crisis. We have nothing. We can't get around that. Mental health challenges and economic hardships also cause it. Policy shifts towards community-based care also provides a lot of surge issues now, because those who we thought should be in hospital are now at home as well. They're sick. They need 24-hour around the clock care. And that's when we take over as well. Technological advancements, expanding services capabilities, and increased funding leading to agency expansions as well. So these are some of the key factors contributing to surge right now. Key challenges during surge periods, impact on services is cancellations and staff shortages. We see that every time around this period of year as well as things progress into outbreak season. There's going to be shortages, and if this variant of COVID-19 or even influenza RSV is one of those variants that aren't well matched with the vaccine, we're going to see a massive amount of new cases of influenza and RSV and COVID this year, which will cause staff shortages. Delays in assessments and transition to virtual consultation, increased demand for vaccinations and in-home care, and shortages of essential supplies like masks and disinfectants. So these are some of the key challenges that we have during surge. However, we can help, as I've said it a million times, alleviate a lot of these challenges by being prepared for this season's cold and flu. So, ensuring staff understand the importance of maintaining a healthy lifestyle, ensuring staff understand the importance of being vaccinated, ensuring that our facilities understand the importance of not just stockpiling, but having enough PPEs in place for staff if things do get out of hand, including disinfectants. Those help this to go. This helps us to move through these surge crises and these surge periods much easier as well. Strategic response frameworks would be resource allocation and support, which I just mentioned. So hire contract staff and private healthcare professionals if need be. Increase funding for surge response programs, which is a little bit out of our hands. That's another discussion. And establish a backup staff pools as well. So again, maintaining a well managed directory of who to communicate when things do get out of hand. Where are we going to get staff? We have 5 or 6 staff members that are ill. We don't want to cancel a program. Who can we call? We have clients that need care, but we don't have enough staff to go out there. Okay, well, we'll call this facility to hire or to take on board maybe contract PSWs or contract RNs. Things like that should be discussed right now, just in case to help manage things as well. And again, going back to outbreak identification, understanding what is an outbreak, what am I looking at, how am I going to handle this, how am I going to make this go quickly, and how am I going to ensure that this is being responded to quickly in a quick manner. So information of suspect outbreak should be reported as soon as possible to area public health units. Public health or agencies will complete initial assessment and determine that the criteria meet the case definition. This is all outbreak stuff, and an outbreak definition will be developed. And again, this is for those who are in congregate cares that are dealing with increased cases in and around this period of time as well. And again, I'm not going to go through this verbatim. It's just the reason why I have this here is just to remind everybody that as we do run into outbreak season, it's good to review some of the outbreak protocols just in case to ensure that we have everything. I hate call it a checkbox response or check in the box response, but it's usually the best thing to do and ensure that, hey, we understand what control measures are for staff and what we're going to expect if things do get out of hand. If we do have residents here or clients or patients, what are we going to do with them? And if an outbreak does occur, who to report to? Who in Republic Health to report to? Who do we call if things do get out of hand? Just a basic reminder, who's doing surveillance? What are we doing with the surveillance information? Who are we communicating with? In terms of environmental cleaning, who's in charge of environmental cleaning? What are we using? How are we going to respond if things do get out of hands? And then as well, in terms of influenza outbreak, who's going to be taking what? Are we going to be prescribing antivirals? What is our policy on vaccination of staff? What are our policy of vaccination of clients? All that needs to be assessed right now to help alleviate surge during this time period as well. And again, just general guidance, encourage employees to get vaccinated. I've said that a million and one times, but it's very important. Developing strategies to minimize exposures to reportable diseases. Providing staff training on required public health measures is very important as well. Ensuring staff passively screen daily with reminders. So as I mentioned earlier on, now's the time to start doing passive active surveillance or screening of staff and of clients. Providing mask-friendly environments for those who choose to wear a mask. Typically what happens in and around this period of time too, the Ministry of Health and Long-Term Care, as well as Ontario Public Health, Health Canada, will tell our health sector that they highly recommend the use of masks in and around this time period. And that's going to be coming out shortly within the next couple of months or so as well. Schedule frequent cleaning and disinfection of high-touch items and surfaces in washrooms, ensuring that your policies are in place for this so that areas are frequently cleaned, regularly cleaned. And I think that, having come out of COVID, everyone tends to be really good in regards to this. There's no question that everyone understands the importance of cleaning and disinfecting properly as well. And informing staff, clients, and customers about actions you're taking to keep everyone safe. Just sharing the information that, what, at the end of the day, we're out here to ensure that everyone who comes into our facility in our ADP programs in the workplace are being safe or handled safely as well, and plan to implement protocols to keep staff, customers, and patrons safe at all times, which I'm sure everyone's doing at all times. So again, as I stated, a lot of these control measures are a lot of what I've been discussing actually is a very outbreak or respiratory response oriented. And the reason for that is during surge, a lot of what causes us to get into this surge criteria is based on the outbreak response and based on the time of year that we are in. And again, cold and flu season is always the number one reason for us getting into surge as well. So as long as these criterias and these things are met within our organization, it should make 2025 and 2026 a much easier year to handle respiratory outbreaks than all the other years as well.
And